Well, we'd like to say again, welcome to everyone currently tuned in again to another Mikey Live program. I am your host, Mikey Hutchinson, and we are live with you from the Spice Isle of the Caribbean, that is Grenada. Listen, the place nice, but we have a struggle right now. The struggle is real, it's rough, it's tough, but we will make it. Welcome to the first-time viewers, and to the usual suspects, we would like to say hello and thank you for joining us. Now for tonight's headlines. Every department at the General Hospital has a worker that is infected with the COVID-19. Shed 1 resumes operation. We'll talk to you about that. COVID-19 cases continue to rise exponentially, and hospital doctor dies. We'll talk about that. Health Minister ashamed at Grenada flag flying at Labor Day event yesterday. NBA, we're talking about the National Bus Association suspension of services. We'll talk to you about that and more when we return from our first break here on Mikey Live. It is what we call news discussed, not told. We have no horse in the race, so we tell you as it is. Tag somebody, and of course, share the thing, share the business so that other people will know that we are live. So family members, we are taking our first break, and we gotta let you know that the headlines was brought to you through the kind compliments of the Communal Cooperative Credit Union, Coach Grenada Limited, Digicel, Nawasa, the Housing Authority of Grenada, Real Value, IGA Supermarket, Superb Distributors. Thank you to all our headline sponsors and to the sponsors of the program in general. We do appreciate you. We're taking a break. If you have not yet shared, share the business. Remember that somebody sharing tonight's program will receive some free credit. Compliments, Digicel. We will be back.
Running low on groceries? Why not visit realvalueiga.com and experience our new online shopping platform? Place your order, then go out and enjoy your day to spend more time with friends and family. Free delivery available within select locations or in-store pickup available. Sounds simple, right? It is. Stress less, live more with Real Value IGA online store, where good food begins.
The Ministry of Agriculture, in collaboration with Ministry of Fisheries and the Senator with responsibility for farmers and fishers, is inviting all farmers and fishers to an online meeting via Zoom to discuss the operations of their trade in a COVID-19 environment on Thursday, September 9, 2021, from 9:30 a.m. to 11:30 a.m. Attend and hear remarks from Prime Minister Dr. The Right Honorable Keith Mitchell, Minister of Agriculture Honorable Peter David, Fisheries Minister Honorable Yulin Bean Hosford, Senator Roderick St. Clair, and officials from the Ministry of Finance, Health, and the Royal Grenada Police Force as we discuss how to move forward in this COVID-19 era. To connect to this very important meeting, visit the Ministry of Agriculture's Facebook page or check with your extension officers for the link.
It's your summer everything loan from the Communal. Borrow up to $10,000 for all your needs. School supplies, staycation, home renovations, appliances or furniture. You can have it all with a summer everything loan. With competitive interest rates and same-day approvals, you can't beat this loan special. Not a member? Join today to get onto this exciting offer. It's your summer everything loan from the Communal. Apply today and take advantage of this exciting offer. Visit the nearest Communal branch or call us at 440-1755 for more information. Lending terms and conditions apply.
After being locked down during the pandemic, get ready for summer with Rika. Live this summer with Rika's Summer in Every Drop promotion. Buy any Rika combo of 6 200ml, 4 330ml, or 3 1-liter Rika juices and get a chance to win. Win Apple AirPods, plunge pools, beach dress with umbrellas, barbecue grill set, gamer set, and weekly pop-up giveaways. With Rika, there's summer in every drop. Promotion ends August 31st. Tickets available at all leading retailers island-wide. Rika, distributed by Superb Distributors Inc., Tempe, St. George's.
Brooklyn, New York, Saturday, September 11th. We get set for Mr. Legs and Friends. Party across the regions. Body set of artists are coming to shell the place. Are you ready for Problem Child? Skinny Fabulous, Charles Marshall, the Jab King Talbri, Iowa George, Looney Spark and Electrify, Mr. Legs.
When I drink, I like to smoke.
Mr. Legs.
As I start to smoke, I want to fuck something.
Blacks. Mandela Links, LFS Music, Linky First, Teddy Rhyme, Inspector, and much more. Get your tickets now on www.partybadd.eventbrite.com or call 646-474-1682.
How going on, boy?
Hey, good old things.
Hey, easy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex or give them a call 440-1015 or 440-1016 or check out their website hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
Diamond Intercontinental Jewelry Store now has amazing deals, special discounted prices on wedding sets, watches, and selected jewelry. We sell top brand jewelry and watches like Citizen at the best price. We offer the best deals and customer service on the island. Opening hours Mondays to Saturdays, 9:30 a.m. to 5 p.m. Diamond Intercontinental Jewelry Store, located at the Esplanade Mall, St. George's, Grenada. Visit or call us today for 14-3114-232-1234 or WhatsApp 533-1581. Sale is on for a limited time only.
Are you prepared for the hurricane season? Do you have a plan? Remember, water is essential in any emergency plan. Determine your family's water needs. Ensure your storage containers are food grade and store at minimum 35 gallons of water per person per day for at least 1 week. Understand that your planning may be different this year because of the need to protect yourself and others from COVID-19. Take the necessary actions to ensure that your household has an adequate stored water supply should there be an interruption. Be prepared. NOWASA, committed to meeting customers' needs.
Yeah, that's right. So committed to meeting the customers' needs. And again, for those of you who are just joining us, we'd like to officially say welcome to you and thank you for being here with us tonight. And again, usual suspects, hello. We have one notice for you from the Ministry of Finance, and they want to let you know that the following offices will be closed to the public on Friday, September 10th, 2021 from 2 p.m. So that's Inland Revenue Division, Cash Office, Carriacou, St. George, Treasury, Carriacou, St. George. Also, we've got the Treasury Sub-Office at the Botanical Gardens and all District Revenue Offices, Cash Collection Center. The Ministry of Finance apologizes for any inconvenience that may be caused by this early closure and encourages taxpayers and the general public to make use of the online payment platform pay.gov.gd and taxservices.gov.gd. Regular services will resume on Monday, September 13, 2021, and that will be at 8 a.m. So they are saying, please be guided accordingly. Okay, so Olia, the next thing that we have to talk, you know, it's Hurricane Ivan's birthday today, right? But so many things have taken over our lives now. Yeah, so many things have taken over our lives that we don't pay much attention to this as we used to. And, you know, I expect that because, again, we are overwhelmed with information just coming at us bad news, sad news, general news. So many things are happening. So that kind of like overshadowed Hurricane Ivan. But of course, we still have to remember the days, boy. In fact, first of all, the actual day when this thing hit after midday. So it's broad daylight, but the place was dark. And following that few hours of intense wind and rain, when we came outside to see what was left, it was heartbreaking. The times following that was crazy. It is similar to what we're experiencing now. We're talking about people having to go to long lines to get a butter container of ice. You guys remember that, right? And you see Mr. Who and Mr. This and Mr. That, they have to stand in line to and listen. They can't come in front of you because they have no status, you know. Stand up in the back there. You know what I mean? Stand up in the back there. And what you want? You want 2 tub of ice? For that your business, you go get your ice for yourself. You want to juke people in line and think nothing so. We were all on the same level. We all learned to appreciate more than ever rice, corned beef, baked beans, and Capri Sun. Listen, we eat this thing morning and drank morning, noon, and night. Listen, at one point in time, I swear corned beef go grow on my chest. You understand? No. Capri Sun for so, rice in all the lily lolo, corned beef in all the lily lolo, and baked beans. But you know, we do eat that until we look like it. And then, slowly but surely, we were able to come out of that. We drew a spot in the road where persons were able to get cell phone service. Who remembered that? And then the entire community will come in that little spot. Now, everybody had a time in the hole. Some people who never go in hole before, they get to go in hole now. You know what I mean? Because the whole day, and everybody had to call somebody, you know what I mean? Those were the days. We took a piece of stone, draw the hole in the road, draw the circle. You understand? And different times in the day, different people go come and they will step in the circle and make their phone call because that's where you could have gotten service. Who remembers that? Then you remember there was no electricity and who had inverters at the time were lucky enough to have inverters. So you start the car, you plug on the inverters and you have your computer, you watch it like a movie. And the entire neighborhood came around. Yeah? Place wasn't dark, but we survived. And if we survived hurricane, if we survived that, I don't know what to call it, then we can survive anything. If we make it here, we can make it anywhere. Point blank. And so today is a day that should remind us that despite the adversities, despite what we are going through right now, yes, we've been there before and we'll do it again. Shed one earlier. Back in business. The general public, you're hereby advised that operations in Shed 1 has resumed. In relation to personal effects, persons, you are kindly asked to contact your relevant shipping agencies in relation to the day assigned for delivery of your particular item or items. Further, due to the change to the government curfew time on Friday 10th and 17th September 2021, operations at the port will cease at 3 p.m. They say they want to apologize for any inconveniences this early closure may cause. And please be guided accordingly. Earlier, the number of COVID-19 cases in Grenada continues to rise exponentially. Statistics from the Ministry of Health reveal that at 9 p.m. on September 6th, the island recorded a total of 1,473 confirmed cases. Coincidentally, that's our area code, 1473. I tell all you, God have a sense of humor. During the past, in other words, you say that is all your own. You understand? During the past week, the number of new cases ranged between 78 and 281 daily. Cases with 231 new cases recorded on Monday. At present, there are 1,194 active cases, with only 9 of these being imported. Females account for the majority of the cases, 54%, with 46% being males. Those who have tested positive for the virus range in age from 2 months, yes, to 92 years old. Now, According to the Ministry of Health, the majority of these cases are persons between the ages of 18 and 60 years of age, with 10% under 18 years and 6% above 60. Listen to that. 10% under 18 years and 6% above 60. The Ministry of Health say that they'd like to remind persons that while the vaccine will not prevent persons from contracting or spreading the virus, it reduces the severity of any symptoms and lessens the likelihood of hospitalization and even death. COVID-19 cases have been recorded in all parishes and on the sister Isle of Carriacou. 14 cases have been recorded in Carriacou thus far, and I think that number just changed, but we'll talk about that in a moment. A total of 1,194 persons are currently in isolation, having had some form of contact or exposure to a confirmed positive case. A further 560 persons are in quarantine. Now, the Ministry of Health said that they are continuing its vaccination program, administering the 2 vaccines which are available locally. Today, 27,046 persons have received their first dose, and 19,483 persons have received both doses and are considered fully vaccinated. Now, the statistics further shows that 4,155 persons have received their first dose of the Pfizer and 56 persons the second dose. For AstraZeneca, 22,891 have received their first dose and 19,427 their second dose. Vaccine administration by parish shows 72.9% of the total doses administered in St. George's, 8.4% in St. Andrew, 3.8% in St. David, 5.2% in St. Patrick, 4.6% in St. John and St. Mark, and 5.1% in Carriacou and Petit Martinique. Now, on the next press conference, I need to ask, what is the rationale for combining St. Mark and St. John? So I'll better come prepared with all the answer, because I'd like to know that. We just need to know. Comparatively, Grenada has one of the lowest rates, they say, of vaccination among Carriacou member states. Statistics published by Caribbean Public Health Agency, CARPHA, in late August shows St. Kitts and Nevis at the top with 39%, Antigua and Barbuda with 34%, Barbados 32%, and Trinidad and Tobago and Dominica with 28%. 4 countries are recorded with rates lower than Grenada: the Bahamas, St. Vincent and the Grenadines, Jamaica, and Haiti. With regards to testing, health officials have conducted 62,307 RT-PCR tests to date. Now, today, at the post-cabinet briefing, the prominent secretary with the responsibility for hospital and community services, Hannah Julian, she gave a little update about the COVID-19 situation in Grenada, similar to what I just gave. And she also gave a breakdown of the latest COVID-19 deaths.
The 7 cases occurring on September 5th, the deceased, all of which had comorbidities, which included asthma, diabetes, hypertension, chronic kidney disease, and cancer. These cases were confirmed as COVID-19 deaths, ranging from an age group of 26 to 85 years old. 3 were under the age of 45 and 4 over the age of 45 years. 5 of these deaths were among patients admitted to General Hospital, with 1 death at Princess Alice, and the 7th person died at home. 4 of these deaths were female and 3 were male. Of the accumulative deaths, 11 of the deceased were not vaccinated. The 1 case that was fully vaccinated was a 97-year-old who suffered from diabetes and hypertension.
I also know of a fully vaccinated case who's also hospitalized. COVID is serious. Serious business we're talking about here. All right. Now, they are saying, too, that persons who die as a result of COVID-19 will be cremated immediately. That's a tough one, too. It's one thing to have already dealt with the death via COVID-19 or as a result of COVID-19, but then again, not being able to see your loved one, it's like, there's no closure, if you ask me. Because one minute you're going to see them going into an ICU unit or something, you're going to see them going into a ward, or you're going to be saying goodbye to them for the night because you're going to come back to visit, and the next thing you know, you're given ashes. It's tough. It's tough. Speaking of tough, today the medical fraternity was dealt a hard blow when the day started to learn of the passing of one of their very own, Dr. Davell Ray, who, according to sources, died early this morning.
Let me start by offering my sincere condolences, thoughts and prayers to the family of Dr. Davell Ray, who passed away earlier this morning. Dr. Ray has been providing yeoman service in the pediatric department and is one of our stalwarts. I recognize Dr. Ray for his contribution as well and volunteering in giving support in our coordination with Martinique. And I want to say that Dr. Donnell would have been, before she became medical director, she was head of pediatrics, so would have had a very strong working relationship with Dr. Ray as well. So too Dr. Mariana Charles, and that is why I'm sure you will understand that they are not here. They are, while they are also in our thoughts and prayers, they are, as Manila spoke to them, on their way to give support to the family of Dr. Ray. So keep us and keep them in your thoughts and prayers. Dr. Ray was 33 years old, and much more to give. We will move on too, though, because there is still the urgency and emergency of COVID-19, despite the fact that we have lost one of our soldiers.
That's the health minister speaking of Dr. Ray. Now, the tributes online is just overwhelming. There were so many persons who were talking and referencing their experience with Dr. Ray. And so I can only imagine how some of these people are feeling at this point in time. Now, Health Minister Nicholas Steele says that he has never been more ashamed to see the Grenada flag flying at Labor Day events. In particular, he referenced, the current activities that happened. He's saying that while Grenada is going through this, it's like, hey, man, read the room, man, read the room. It was just in poor taste that persons were willing to ignore, Grenadians who was living abroad, willing to ignore what we are going through here and risk their lives in the same fashion, he says, that they did here during August.
I have never been more ashamed to see the Grenada flag flying as I have watching it this weekend, knowing that there is death here in Grenada from outbreak of carnival, unofficial, unsanctioned activities. To see some Grenadians supposedly proudly flying our flag in New York, doing the same thing, participating in another country, to unsanctioned, unauthorized activities, flying the Grenadian flag. And what was more insulting, there is a picture circulating, and I think it does depict what it has done to us as a people, that the flag is so sullied and dirtied with old oil. And this person somehow is representing us as a nation now, while we at home are fighting to overcome and survive the damage and destruction that was unleashed from the mass events. We need to speak to that. Those are our fellow brothers and sisters as well. And we need to embrace them and help them to come to terms with the way our...
All right, that's Minister Steele speaking of persons deciding to go out and celebrate Labor Day despite what it is that we are going through here as a nation. Now we are continuing. Now, according to the Ministry of Health, now, and I'm quoting here from a release coming out from the National Bus Association. Now, the issue is about to get real. According to the Ministry of Health, says the Bus Association, Honorable and the Minister for Health, Honorable Nicola Steele, we need to find a balance between life and livelihood. Based on the steady increase in COVID-19 positive cases, deaths, and the current conditions that we are operating under, such as 1, no assistance in the sanitization of buses after each trip, assistance is given with sanitization liquid only for passengers boarding the buses. However, with already high operational costs, bus operators are unable to fund this at this time. 2, the use of public transportation to get to and from testing sites without persons being aware of their COVID-19 status. 3, the rise in the number of operators testing positive for the COVID-19. 4, less persons traveling along with reduced operating hours due to the curfew. And to combat the spread of the COVID-19, we advise that all our members suspend your operations from Wednesday 8th September 2021 to Wednesday 15th September 2021 in the first instance. We are unable to see the balance between life and livelihood at the moment. Both our life and livelihood are in jeopardy, and we urge all operators to choose life now. The National Bus Association has held many consultations, they say, with medical professionals regarding COVID-19 protocols and vaccines that are available. The ultimate decision is now on you, the members. Simultaneously, we wish a safe recovery to all those experiencing this dreaded virus, and our condolences go out to the family of those who would have lost their lives. It goes on to say that we thank everyone for the continued support and understanding in this regard as we move forward to building a safe Grenada. When asked about this today, the Minister for Health said that he isn't privy to any decisions the busmen might have made, but he don't believe now is the best time for withdrawal of services. But he went on to say as well that he understands the position of the busmen.
The way I'm not privy to any decision that the Bus Association has made, but the way the question was framed is the way that I can answer. So in terms of withdrawal of services or so, but the way you have described it, that is most definitely a legitimate concern, not just of bus operators, but most providers of in the private sector, of which the Bus Association is part of. And I know they were present in meetings with the private sector that Prime Minister held recently, and so there's discussion and dialogue. So that is my comment and position on it. Regardless, this is not the time for withdrawal of services in protest. This is the time to consider the safety of yourself and your family. This is that time, yes. And if that is the position that any association, bus association or any other association is taking, that I cannot fault them for. And in fact, to an extent, I would say let us discuss and find ways to do that safely and to the benefit of all.
All right. Now we are moving on. So that's left to be seen tomorrow. I know that there are some busmen who will not follow the guidelines of the association. But to what extent, let's see what's going to happen tomorrow, right? Every department at the General Hospital is affected by COVID-19. Every department has a worker who is infected with COVID-19 at the General Hospital. I'm not the one saying that. This comes from the horse's mouth at the General Hospital. Dr. Carl McIntosh, Director of Hospital Services. Over 60 healthcare workers affected by COVID-19. Listen, even in the communities, there are healthcare workers who are affected by COVID-19.
Yes, we have patient nurses, doctors, housekeepers, groundsmen, security, laundry. Every part of the hospital department has someone that is positive, and they are at home isolated until they are able to come back to work. We have not asked any of our employees, and we don't have any employees that are expected to work, whether they're asymptomatic or symptomatic and COVID positive. That is not something that is being done. It has hit across all of the staff, but however, we continue to reach out to have relief, and that puts it onto the next colleague to do the extra that is necessary. So we push. We can't stop. And as Minister Steele has said, we have to keep pushing. We don't have an alternative. So as it relates to the manpower at the hospital, when you're talking about for the doctors and nurses that are able to oversee for the isolation wards and making sure that they manage the COVID patients, as it relates to the ancillary and auxiliary staff, of course, we've always understaffed, but we continue to provide as best we can across the board in all the services.
They are saying that they've always been understaffed, but they are more challenged now, but they will get the job done. We can't just merely say thank you to the nurses after this, you know. When this is all settled, when the dust settled, we have to do by them right. We have to do by them right. You understand? Or else we go our problem. I'm reminding you guys, you need to reward extra effort. You can't just say, well, they are dedicated. It doesn't work that way. Yes, they are dedicated. Yes, they are doing their work to the best of their ability. But a tap on the shoulder goes a long way. These people and them just be depressed at nights with some of the things that they see, some of the cases that they have to deal with, understanding that their patient has died or is not getting better quick enough and all of that. These people take this thing personal. Some of these nurses, and when they go home to their families, they can't give to their families themselves because they are so consumed with what is happening at work. It's not just a job for these people. It goes way beyond that. And so do right by the nurses, okay? Do right by the nurses. I don't talk. All you. We told you there were 14 cases of COVID-19 in Carriacou and Petit Martin. Now, that was yesterday. And you know that there were mass testing and vaccination happening in Carriacou today. As a result of the operations today, 5 additional cases were identified. Okay? Whoa. And they say that they are continuing to do more tests as they do the contact tracing and so on. That takes their total to 19 positive cases identified in Carriacou, active cases currently in Carriacou. Wow. Yep, that's what it is. We expect to get the dashboard. Okay, here it comes. Here it comes now. So, okay, so as of now, let us give you the new dashboard as published by the Ministry of Health. Grenada today recorded 140 new cases of COVID-19. Currently, 26 persons are hospitalized. Grenada now has a total of 1,302 active cases of COVID-19. 8 are import-related or imported, and the active local cases stands at 1,294. We are also seeing that there are now 13 deaths as it relates to the COVID-19, okay? So there are now 13 COVID-19 related deaths in Grenada. Yesterday it was 12, so it therefore means that one person from yesterday to today has died as a result of COVID-19, taking the number from 12 to 13. Ay, ay, ay. You know, it makes your belly boil. That's what's happening with me right now. Okay, so folks, we are going to take a break and come back. We want to again remind you that when we come from the break, we have for you the national report and the weather. So stand by for that. And if again you're looking for a company who can record or videotape, as we call it, or stream your wedding, your funeral service, your private meeting, or your commercial meeting, whatever it is, you can give me a call, or you can send me a message. Of course, that's one of the things that we do, all right, in a very, very, very professional manner. All right, so the next time you have a funeral service and you would like to have that broadcast to your family and friends privately or publicly, we are able to do that for you. We are taking a break and we'll be back with the national report and the weather shortly. Stay tuned.
Running low on groceries? Why not visit realvalueiga.com and experience our new online shopping platform? Place your order, then go out and enjoy your day to spend more time with friends and family. Free delivery available within select locations or in-store pickup available. Sounds simple, right? It is. Stress less, live more with Real Value IGA online store, where good food begins.
The Ministry of Agriculture, in collaboration with Ministry of Fisheries and the Senator with responsibility for farmers and fishers, is inviting all farmers and fishers to an online meeting via Zoom to discuss the operations of their trade in a COVID-19 environment on Thursday, September 9, 2021, from 9:30 a.m. to 11:30 a.m. Attend and hear remarks from Prime Minister Dr. The Right Honourable Keith Mitchell, Minister of Agriculture Honourable Peter David, Fisheries Minister Honourable Yulin Bean Hosford, Senator Roderick St. Clair, and officials from the Ministry of Finance, Health, and the Royal Grenada Police Force as we discuss how to move forward in this COVID-19 era. To connect to this very important meeting, visit the Ministry of Agriculture's Facebook page or check with your extension officers for the link.
It's your summer everything loan from the communal. Borrow up to $10,000 for all your needs. School supplies, staycation, home renovations, appliances or furniture. You can have it all with a summer everything loan. With competitive interest rates and same-day approvals, you can't beat this loan special. Not a member? Join today to get onto this exciting offer. It's your summer everything loan from the communal. Apply today and take advantage of this exciting offer. Visit the nearest communal branch or call us at 440-1755 for more information. Lending terms and conditions apply.
After being locked down during the pandemic, get ready for summer with Rika. Live this summer with Rika's Summer in Every Drop promotion. Buy any Rika combo of 6 200ml, 4 330ml, or 3 1-liter Rika juices and get a chance to win. Win Apple AirPods, plunge pools, beach dress with umbrellas, barbecue grill set, gamer set, and weekly pop-up giveaways. With Rika, there's summer in every drop. Promotion ends August 31st. Tickets available at all leading retailers island-wide. Rika, distributed by Superb Distributors Inc., Tempe, St. George's.
What does it take to be an amazing woman? Lots of me time. Amazing women are classy, fancy, and a little sassy. It's the drink for me. Cheers! Sometimes you've got to show them who's boss. Alpha male? Nah, alpha females are more amazing. Cheers to securing the bag. We make time for ourselves, for work, friends, and we certainly make time for passion. We're simply amazing. Amazing cream liqueur for the amazing woman in you.
Summer is ending, but the deals are just beginning with the Court's end of summer sale. Get up to 50% off your favorite items, to include patio furnishings, pools, coolers, TVs, mattresses, and more. Plus, shop today with a ready finance and pay nothing for 60 days. Take advantage of these sizzling summer deals for a limited time only. Shop in store and online at shopcourts.com. Conditions apply. Courts, bringing value home.
Brooklyn, New York, Saturday, September 11th. We get set for Mr. Legs and Friends. Party bar. Mr. Legs and Friends. Party bar. As the region's body set of artists are coming to shell the place. Are you ready for Problem Child? Skinny Fabulous. Charles Marshall, the Jab King, Talpree, Iowa George, Louis Spark and Electrify, Mr. Legs.
When I drink, I like to smoke.
Mr. Legs.
As I start to smoke, I want to fuck something.
Blacks. Mandela Links, LFS Music, Linky First, Teddy Rhyme, Inspector, and much more. Get your tickets now on www.partybadd.eventbrite.com or call 646-474-1682.
How going on, boy?
Hey, good old things.
Hey, easy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex, or give them a call, 440-1015 or 440-1016, or check out their website, hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
Diamond Intercontinental Jewelry Store now has amazing deals, special discounted prices on wedding sets, watches, and selected jewelry. We sell top brand jewelry and watches like Citizen at the best price. We offer the best deals and customer service on the island. Opening hours Mondays to Saturdays, 9:30 a.m. to 5 p.m. Diamond Intercontinental Jewelry Store, located at the Esplanade Mall, St. George's, Grenada. Visit or call us today for 143-114-232-1234 or WhatsApp 533-1581. Sale is on for a limited time only.
Are you prepared for the hurricane season? Do you have a plan? Remember, water is essential in any emergency plan. Determine your family's water needs. Ensure your storage containers are food grade and store at minimum 35 gallons of water per person per day for at least 1 week. Understand that your planning may be different this year because of the need to protect yourself and others from COVID-19. Take the necessary actions to ensure that your household has an adequate stored water supply should there be an interruption. Be prepared. NAWASA, committed to meeting customers' needs.
Welcome to Yogo. Most of you know us for our food delivery service and our food pass for free delivery from restaurants. But did you know you can also use us for grocery deliveries too? We've just added another 5,000 plus new items to Yogo Supermarket. And stay updated as we add more products and vendors. Yogo Services is our convenient skip the line offering. Let us pay your electric, water, and other utility bills for you. With us, you will be able to buy tickets, pay your rent, schedule bookings, and other services. Need a ride to get somewhere? Give Yogo Lyft a try. Select your pickup location and destination location and wait for our driver to collect you. Never have to worry about how you're gonna get to a place again. Please see website or app for our service locations. And sign up now.
COVID-19 cases continue to rise exponentially. We'll have details to this story and more in the national report. With the details to the news for Tuesday, September 7th, I am Rikisha St. Louis. The number of COVID-19 cases in Grenada continues to rise exponentially. Statistics from the Ministry of Health reveal that as of 9 p.m. on September 6th, the island recorded a total of 1,473 confirmed cases. During the past week, the number of new cases ranged between 78 and 281 daily, with 231 new cases recorded on Monday. At present, there are 1,194 active cases, with only 9 of these being imported. Females account for the majority of the cases, 54%, with 46% being males. Those who have tested positive for the virus range in age from 2 months to 92 years old. The majority of the cases are persons between 18 and 60 years of age, with 10% under 18 years and 6% above 60. The Ministry of Health reminds persons that while the vaccine will not prevent persons from contracting or spreading the virus, it reduces the severity of any symptoms and lessens the likelihood of hospitalization and even death. COVID-19 cases have been recorded in all parishes and on the sister isle of Carriacou. 14 cases have been recorded in Carriacou thus far. A total of 1,194 persons are currently in isolation, having had some form of contact or exposure to a confirmed positive case. A further 560 persons are in quarantine. The Ministry of Health is continuing its vaccination program, administering the 2 vaccines which are available locally. Acting Permanent Secretary in the Ministry responsible for hospital and community health services, Hannah Julian St. Paul, during Tuesday's post-cabinet press briefing said over 19,000 Grenadians are now fully vaccinated. She shared a breakdown of the vaccine administration.
At present, there's 27,046 persons have received our first dose vaccines and 19,482 persons has received the second dose of vaccines. Therefore, they are considered fully vaccinated. And if I were to share with you a breakdown of the percentage of persons vaccinated within our parishes, St. George's has a percentage of 72.9%, St. Andrew 8.4%, St. David's 3.8%, St. Patrick's 5.2%, St. John's and Mac 4.6%, while Carriacou and Petit-Martinique has a 5.1%. To date, we have conducted over 62,370 PCR tests.
Comparatively, Grenada has one of the lowest rates of vaccination among Carriacou member states. Statistics published by the Caribbean Public Health Agency CARPHA in late August shows St. Kitts and Nevis at the top with 39%, Antigua and Barbuda with 34%, Barbados 32%, and Trinidad and Tobago and Dominica with 28%. 4 countries are recorded with rates lower than Grenada: the Bahamas, St. Vincent and the Grenadines, Jamaica, and Haiti. Health and Social Security Minister Honorable Nicholas Steele says Grenada has enough PCR swabs to conduct tests as the ministry's aggressive PCR COVID-19 testing continues in light of the community spread of the virus. Minister Steele said the country has the ability to conduct 17,000 PCR tests. So far, Grenada has spent $17 million to procure machines, test kits, and reagents for testing since 2020 when the virus was first detected. The health minister explained that the quantity of swabs available is enough to be distributed to various facilities currently assisting the ministry in mass testing island-wide. He said additional test kits are regularly procured to ensure continuity in the ministry's test drive. To date, Grenada has conducted 62,307 rapid test PCR tests.
The number of tests currently, PCR tests, I can give you a straight out answer, but let me explain a bit. PCR tests in particular, it's a chain of various things that you need to make sure you have enough of each. So me telling you the number of reagents and telling you that we can do over 300,000 tests there is not the realistic picture. That's how much reagents we have and how much tests can be done at the lab. But each of those, the sample needs to be taken from that nasal swab. So that is right now where we are at our lowest numbers within that system, and that is 17,000. So we have the ability to do 17,000 PCR swabs. So that means 17,000 PCR tests, although we have much more reagents, etc. So yes, there are more swabs on the way that will allow us to continue the constant flow.
Rapid antigen tests are also being used to confirm COVID-19 cases. Minister Steele told members of the media on Tuesday during the post-cabinet press briefing that recently, due to intensified testing, the ministry has doubled the use of rapid tests.
It gets tested at times like these, where we are seeing a significant drop and have had to make sure that additional orders and emergency orders are placed, is in the rapid tests. As you're very much aware, we have shifted and are using considerably more, almost 1,000 times more rapid tests over the last week and a half. So that also has to be increased. We have in the past, when we did not have a high demand, we have shared some of our tests with neighboring islands when they were in their time of need. And we are also requesting from them just to make sure that we keep that buffer in place as best as possible.
This is the National Report. The news will continue after the break.
This is a message from the Ministry of Health. If you or a family member suspect that you may have contracted COVID-19 and are displaying symptoms, please immediately self-isolate at home. This means that you must also avoid all contact with other members of your household. Do not visit hospitals or health centers, as this creates the potential for further spread of the virus, and it puts additional persons at risk when you come into contact with them. Your best course of action is to call the COVID-19 hotline at 458-4787 or 538-4787, or contact your nearest health center or medical station. Once your information has been received, health officials will come to you. Help prevent the spread of COVID-19. This has been a message from the Ministry of Health.
Continuing the news, the Ministry of Health says further adjustments will be made to services offered at the General Hospital and various community health facilities as the sector continues to grapple with the effects of COVID-19. The rapid rate of community spread has impacted the health sector, with over 60 in mandatory isolation due to exposure to COVID-19. Director of Hospital Services, Dr. Carol McIntosh, said Tuesday a decision has been made to scale down some of the services being offered to cushion the effects of having so many health workers absent from the job. The significant increase in confirmed COVID-19 cases is forcing operational changes in various sectors. At Tuesday's post-cabinet media brief, Dr. McIntosh said services will continue, but on a smaller scale. Dr. McIntosh gave the assurance that although the workload has increased and the ratio of patients to healthcare staff is much more, administrators have taken additional steps to maintain the well-being of healthcare staff.
When you're talking about for the doctors and nurses that are able to oversee for the isolation wards and making sure that they manage the COVID patients. As it relates to the ancillary and auxiliary staff, of course, we've always understaffed, but we continue to provide as best we can across the board in all the services. The clinics at present, we're lessening the amount of services that we're able to provide, as well as increasing the amount of time, so 12-hour shifts that we're allowing. So for those who are in the auxiliary and ancillary, that would allow for them to be able to provide the services with a lesser number per day, and then also allow for them to rest in between. For the doctors and nurses, the same thing. We're putting less services in and going more on emergency services so that we can pull people in as necessary to provide the immediate services that are necessary. We're not stopping services to people. We keep talking about COVID-19, but remember, we have our regular admissions, patients, deliveries, emergency surgeries, which will continue.
Acting Permanent Secretary in the Ministry of Health with responsibility for hospital and community health services, Hannah Julian St. Paul, said the community clinics and health facilities have also been affected by the number of positive COVID-19 cases among staff. She said the services offered at the clinics will be merged to avoid frequent visitation and reduce exposure to the virus, particularly among the elderly.
Our community nursing department currently has 13 nurses that are being affected by the disease and cannot be able to provide service at this point in time. And that also has impacted the community health services and resulting in us have to take some actions there as well in order to continue the services within community health. And what persons would be seeing in the week ahead is that we have to scale back on some of the services that are offered within community. So our maternal and child health service, vaccination program, our pharmaceutical services, we are now looking at how do we merge some of these services together. So whereas persons used to access these services on different days, we are trying to merge these services so that when persons go to the health service, to the health facility by appointment, on the day given for your appointment, you can access several of these things one time. And that would help with the exposure as well, because we don't want persons to be coming to the facility as often as they used to, especially our elderlies. So we also are putting some systems in place as a result to have our elderly persons managed at home, persons with chronic illnesses. So we'll be increasing their supplies, like the medication and other supplies that they access at the facility, which would reduce the number of visits they have to be making to the health facility, as well as allowing the limited staff that we have to be able to serve the community.
The ministry continues to commend staff at hospitals and community health facilities for the service they continue to deliver despite the added stress brought about by COVID-19. Health and Social Security Minister Honorable Nicholas Steele is high in praise for the entire health team, and he's optimistic that under the guidance of the current team of doctors and nurses, that Grenada will get through this difficult period.
At this current rate of spread, our health system will be tested to the max. Will be tested to the max. I cannot think of a better team I'd rather have for that test. But unfortunately, for that team, these are going to be very dark and difficult days ahead of us. But the team will come through. Let me say again, I cannot think of a better team to have than the team we have now. Whatever our challenges are, this is the right team to get past it.
Assistant Commissioner of Police Jesmond Prince says police presence will be heightened throughout communities as the state of emergency continues. He said as of Friday, September 4th, officers were deployed in several communities to increase foot and vehicle patrols. The increase, he said, will assist the government and the Ministry of Health to keep track of events and activities being held that pose a possible threat to the further spread of the virus. According to ACP Prince, access through checkpoints will only be granted to individuals with identification card or authorized passes from the RGPF.
Accessing passage through these roadblocks require every person, to have an access pass, which would be issued by the Royal Grenada Police Force. In the regulation, there are listed a number of essential workers. And if you are belonging to any entity, any company or institution, and that institution has an ID system, we are expecting and anticipating that you will have that ID system with you when you are accessing the checkpoints. If you are without an ID, accessing these checkpoints could become very difficult, because the only way that we can identify you as being an essential worker is through some form of identification.
He encouraged drivers and workers to use the passes for the intended purpose. ACP Prince explained that measures are in place at checkpoints to record ID and vehicle numbers for future use.
You're not going to be using your ID to bust a line. And the reason for that is because every time you cross a checkpoint, that ID and yourself, vehicle number and all of that will be recorded. And so if for some reason the checkpoint supervisor realizes that you are not looking as though you are officially from duty or officially going to duty or to perform some essential service, that will be recorded, and a check will be made against your management to know that whether or not on that particular time and so on of the night, whether or not you are on official engagement for your company. So please, we are trying to avoid and to keep this thing under control, and we're asking everybody to use the system that is in place to ensure that no one is exposed unnecessarily to this situation.
That story just ended the national report for Tuesday, September 7th, recapping the top story. COVID-19 cases continue to rise exponentially. On behalf of the entire news and production team, I am Rakisha St. Louis saying thank you for joining us. Until next time.
Thank you very much, Rakisha, and the rest of the GIS team. And we look forward to hearing from you guys tomorrow, God's willing. Now, we are going to take a look at the weather. And what we can see here from the Met Office is that the weather is expected to be generally fair, increasing in cloudiness at times with light to moderate showers. Now, tonight's minimum temperature is expected to be about 25 degrees Celsius. Winds easterly to southeasterly at 10 to 20 miles per hour. Seas slight to moderate with waves 3 to 5 feet in open waters. And that's, my friend, your weather report for tonight. I'd like to take the opportunity now to say hello to a few people on the program. So we have Kireen, Shireen, Michelle, Zaka, Charmaine, Ricardo, Rachel, Romel, Shireen, Pearl, Zaka, Eunice, Cynthia, and Jane, and Allah and Cassie. Be safe all. And Angel, hello to you. We have more than one Michelle's on the program. And Sha, and who else? Everyone else on the program, quite frankly, we would like to say hello to you, all right? Rolanda, Glenn. Rolanda, change your name now. Change your Facebook name to something. Rolanda, change your name and tell me what it is. Okay, Rolanda. Cherry and Jeffrey. Cassie. Yeah, again, I take a kiss from Rolanda. Ah, Rolanda, thank you. Don't change your name again. Vicky, Yvonne, Anshel, Doris, Raven. Okay, Raven, sorry. I taking back my call. I ain't calling Shireen again. Anne, Pearl, Denise, Ventress. Those of you who are, yeah, Cassie, big up. Those of you who are on YouTube, I'd like to say hello to you guys, all right? All of you on YouTube, yeah, I could say hi too, and I will see all you. The people on YouTube, if you comment in the comment section, I'll get to see you too. Joseph, Kathy, who else? Bermuda, I Bright Long, Claudette, Ching Ling, Chien Lee. Hi, how are you? Small man calling me. Kimo. Big up Paul again. Lorraine. Tyrone. My son is calling me. He realized it's time. A man know 10 o'clock, like I don't know, you know. Wendy and Jamie. I say Tyrone already, right? Java, Clarice, and everyone else. Thank you again, and we touch base tomorrow, God's willing. Again, everyone on YouTube, thank you, and we hope to see you again tomorrow, God's willing, as well. Don't forget to share the business if you have not done so, all right? Dolores and Wendy and Brenda. Take care, guys. Let's go. In 5, 4, 3, 2, 1, we all say, Ja! No! Take care. Have a good one.